Some of the best vehicle extrication teams in the West Coast are competing. Scenarios are set up for the teams, who then see them for the first time. Coming up is a limited scenario where live patients are used. However, hydraulic tools may not be used. Let's observe the team from Lakewood Fire Department, Lakewood, Washington, as they arrive on scene.
Two-car crash, heavy intrusion, one car against the barrier.
I say!
Yes!
One patient, driver's side, gold car!
Patient, driver's side. Medic's got a patient, driver's side. Medic's on the way!
This is Lakewood Fire Department, Lakewood, Washington. They do have a car up on another car with a car in a Jersey barrier, patient being in the bottom car. Right now their objective is to stabilize the vehicle, making sure that they fill any voids in between the Jersey barrier and the car, make sure the top car gets stabilized as best as possible. Their plan now, they have a plan A and a plan B. It's always best to get your plan A right off the bat so the team knows what's going on. They did their inner and outer circle. They found the patient, and now they're just formulating the plan. And I heard them say they're going to cut the roof off and get the patient out after the roof is cut. Medic's job is to make sure that the patient is awake, alert, and oriented. For this is the limited scenario, so there is a live patient inside. And their objective is, as a medic, is to make sure that they look straight ahead, not moving their head. Patient's safety and security is pretty much the first priority on all these scenarios. They're going to head and take the Rescue 42 struts. Looks like they're going to put it underneath the wheel well and get it done that way. They're taking off all of the stems, keeping the car secure to the floor as well. The objective of the Rescue 42s is to keep a 45-degree angle, keeping the base of the 42s on the ground. So they're going to want to secure it to either each other or something, if they have straps going off to the sides. But it's just making sure that the car will stay in place. The IC's job is to just keep moving around. They're going to get scored on how well they formulate their plan, how well they communicate with the medic, making sure that the patient is kept in mind through the whole scenario as well. And he's the ultimate safety officer, just doing the 360s and making sure that everything stays nice and secure. Team members, as they're working on the ground, are advised to keep one knee off the ground at all times. It's almost dinged if they do get two knees on the ground, that way that they're in the collapse zone especially, that they always have a way to rapidly get out. Once the vehicle's secure as it is now, the medic would be able to go ahead and make patient contact and secure inline manual stabilization. Some teams like to have a medic and a medic helper, so that way the medic can stay in the front with the patient and do a full primary, secondary survey that scores extra points.
When we get a chance, we need to look at batteries and airbags, make sure her car's
IC just did his great job making sure that all vehicles are shut off, secured with the emergency brakes, and that all SRS devices, if they have them, have or have not been deployed. It's something that should be communicated by either the interior person, like the medic helper, or one of the team members that are visually taking care of the car.
Plan A is still in effect. Make sure we got total protection.
Anytime they cut, break glass, or do anything else, they do have to make sure that the patient is covered with hard protection. In this case, they have accordion protection, which can be used as hard or soft protection. The patient does seem to be covered and protected really nicely. The medic is in with her, and his job now is to just keep constant talking to the patient, letting the patient know what is going on, the sounds that they'll be hearing, anything that we would do on a regular scene, just to try to keep the patient in a comfort zone. hear all the stuff that we might know what's going on in their situation with their stress. They might not know anything about what's going on with the situation. And his job is just to keep the patient as relaxed and their mind on something other than the noise.
Everybody, you still have glass, respiratory. Keep your respiratory up.
Respiratory protection is important, especially around the glass. Whenever we're breaking or cutting, because the glass dust is very bad for the patient, for respiratory problems. Anytime they break glass, they shouldn't use their hands to clear it out of the way. That's a safety consideration. If they have something to clear the glass with, they go ahead and do it, other than their hands, like the tool they use to clear it with. Usually if we use a glass master tool, you just take the other end of it, the handled end, and clear out the glass once you break it.
Jay, we have any more changes? Okay,
I've cut the ear. I have not cut the post yet.
All sharps, once a certain part of the vehicle is cut, they want to wrap the post if that's what they're cutting, and making sure that that's for their protection as well. And that way, in case they back up into it or something, they're not going to get nicked or cut in any way from a sharp, jagged edge. The work area that they work around should be free of clutter. If there's tools that they're using that they're no longer using, they should have them out of the way. That's a part of the safety that the judges do look for. They're judged also on their knowledge of tools that they're using, making sure they know exactly how they operate and what they want to use them exactly for. Now what they're doing is they're just trying to get the come along ready. What they're going to do is flap up the roof up towards the other car and keep it there in place, because once they cut it and they fold it up, it would be a safety violation, a critical safety violation if that roof came crashing back down on any one of the members of the team or on the patient themselves. So they got the come along ready, and they're also protecting the medic in case that were to happen as well, plus the come along is in place. So they're going to cover every area with the hard protection.
Okay, everybody, watch your ears.
They did save the B-post cut for last, which is what they should have done. The optimal way to cut would have probably been away from the medic. Start at the medic, go away. They do have hard protection in place, so that should be okay. Ideally, with any cut with a Sawzall, you want to make it one continuous cut, just so that way your cut does line up. That's why it would have been good to go start at the patient and the medic and work the other way. They do have the cut made, and they're ready to start folding up the roof, flapping it up.
Okay, stabilization is still secure. We're ready. Let's watch that with your car.
The good thing is they already have a crease in the roof, so it shouldn't be so hard to get it strapped and flat back upwards.
We have good access in there. Thank you. Clear. Good. Okay, we're going to do sharp protection. Sharp protection. Watch your left.
Another thing, what they have to do prior to doing any cuts of posts is they would like to expose any of the paneling, making sure that they're free of any pre-tensioners of the seat belt. Making sure, especially if they're on the newer technology vehicles, that the SRS systems aren't up there. They would be labeled if they were there.
20 minutes on scene, you guys.
Now the medic's going to go ahead and just get if they hadn't already done so, getting the seat collar attached, figuring out a way to get the patient out. He should have been in there making sure that the limbs were all free and
left arm only. All right, time.
ready to be removed.
Good job.